Magic 89.9.
It's Best Music Magic 89.9, 609. Welcome to Healthline. I'm Tina Ryan, and with me is, we always have like the same sounding name.
I know,
right? Oh, sorry, your microphone. sorry.
I know, right?
Diba?
So it's Healthline with Tina Ryan and Doc Ryland.
Doc Ryland. And Doc Ryland happens to be an orthopedic surgeon and a DNA profiler and a superstar in Bella's eyes. Finally, nice to meet you, Bella. Ang cute ng baon ni Doc, diba? Yung daughter niya.
Bodyguard coach.
Bodyguard. Bella, nice to meet you. I hope you stick around. Okay. There's always, I don't know, the pantry if you get bored. But anyway, Doc, happy hump day. It's a midweek. What's happening?
Well, first of all, I'd like to say hi to everybody that's in their cars right now. I mean,
Okay, I don't know where you were on Monday, but why was the traffic insane on Monday? There was something
just
different.
Monday?
No, I mean, today was tolerable.
Well, yeah.
But Monday was just, I don't know what happened.
I don't know.
Yeah, but we're here till 8. If you have any medical questions, we have an expert right here. Yeah, and also the next hour, I'm very excited because this is the first time I'm meeting a doctor of that.
Lifestyle medicine.
Yeah, I have. Yeah, so we're gonna
ask what that's all about.
Save that for her
Yes,
on the second hour.
we will.
Right now, if you have anything in mind that you want to ask Doc Ryland, mapabuto man yan. What else does an orthopedic surgeon tackle? Bukod sa buto, Doc.
It's bone and muscle, so...
Which I don't have, by the way.
Well, regardless if it's how small or how big it is, or how thick or how thin it is, it's still the same thing. So it's bone, muscle, joints, anything that deals with it. So from pain, from spine.
May mga rayuma dyan.
Well, yeah, that included.
Wait, rayuma is the arthritis.
Okay, rayuma is actually coined from the term rheumatoid arthritis. Yeah, that's why it's called rheuma. But technically, arthritis is any joint inflammation. It comes from two words, arthro and itis.
Okay.
Arthro is joint, itis is inflammation. So.
But break it down. I'm so happy that I have you on the show. 611.
I'm so happy to be here with you.
The love is mutual. Anyway, if you wanna hear from Doc Ryland, talk to him on the phone, 863-10899. We also have our Viber number.
Yes, our Viber number is 0945-971-4011.
So again, if second hour, do not go anywhere because we have a very special guest. Right now, let's go back to more of today's best music, something from Post Malone and Morgan Wallen.
Magic 89.9.
Real talk about your health tonight in between music sweeps. This is Healthline with Tina Ryan and Doc Ryland.
Yes.
Mark and his gym crew just messaged me via my Instagram, Doc. Hold on, let me put some background music. How about that one? Sounds cool?
Cool.
Doing their cool down to Healthline because recovery is the real flex. Nice.
And you have to do that.
Yeah, because why is there another term? What is another term for cooling down after like a hard workout?
It's recovery.
Okay, so why is that so important?
Well, remember we were talking about a few episodes ago about inflammation. There's good inflammation, there's
Bad inflammation. We want to be on the good one.
Exercising is actually still an inflammatory reaction. That's why we get this big muscles and all of these setting and strength that we get. But at one point in time, you have to recover from it. Otherwise, you get too tired. And it goes worse than that. So you have to recover. That's why you cool down after your workout.
And what is the ideal time for a cool down? Okay, 30 minutes?
15, 30 minutes?
15, 30 minutes? What's the worst case scenario, Doc? If you just leaving the gym and you go about your day?
When you do all of these exercises, everything hypes up. Your heartbeat, your breathing, and all. That's the reason why I want to calm you down to return to normal all of these vital signs. So if you could just imagine you were working out, your heart beats more than say 120.
Lalo na pag nandun si Crush at gym.
180 na yata yun. But yeah, your heart's beating fast. So you have to cool down to bring it down to 100 or less. And if you don't, what if it just continues? You might simply just get a cardiac event or worse is a heart attack.
Oh my gosh.
So that's the reason why you need to cool down. In as much as before working out, you need to stretch, you need to
Warm up. Warm up, then cool down. I get it now. Hello to Benny Quarter who says, pakaganda naman yun. Doka, I'm not lying. That's Benny's message. Okay. Hi, Benny. You're so sweet. Hi also to JP and Hikaruru. Do you still take requests? Of course. He's asking for, or she's asking for Ghost by Baby Monster. Hi also to Christian. Again, we're live on playback.tv/magic899. Anytime, anywhere in the world. Here we go. On our second hour, we have a good friend of the doctor here.
Yes, we're going to be talking about lifestyle medicine.
That's right. And her name is so cute.
Yes.
I just had it for lunch too. Doc Sushi's going to be with us.
Yep.
And you wanted to congratulate some people today.
I'm kind of, like in a tie and coat and suit and everything else.
I know. Like,
No, but-
he walks in here looking like $1 million. I borrowed someone's blazer.
How I wish I had $1 million.
Right?
No, but I just came this morning from the 127th Armed Forces of the Philippines Medical Service because it's their anniversary today. So they kind of gave awards to outstanding
individuals
and in uniform. I mean, thank you to all of them, and they also gave awards to partners. That's the reason I was there. I was representing the president of the Philippine Medical Association. So, I was
Where
there.
you go? You're just the governor.
So we were there. And I'd like to congratulate, of course, the AFP's Surgeon General, none other than Brigadier General Fatima Navarro, because she's like on top of all of the doctors, nurses, veterinarians, dentists, and all of the other paramedical staff of the entire armed forces.
Wow.
It's under her wing, so congratulations to her.
Look at
as
her.
well.
When are we going to have her here?
We'll invite
Bring her
soon,
over.
Soon.
Yes, please. Love to talk to her. 863-10-899. If you have any questions for Doc Ryland, I think I'm going to be lucky tonight with this phone line. If not, I'm not going to, you know what? I'm not going to show up next week. Do the show alone. Just kidding, Doc.
No way.
I'm kidding. Here's something from Diwata called Nasusunog or Pants on Fire. Today's best music, 625 on Healthline.
Magic 89.9.
Tobacco PM. Lola Moore and Madeline. That one's called Misbehave. The one earlier I played was Sa Panaginip. Not bad. Okay, Doc, I know you have some shout-outs, so go ahead.
Shout-outs right
He's
now.
popular, you guys.
I'm not.
I'm going to say.
No, but I'd like to say hi to Paul Alcazar right now. He's listening to us.
Hi,
as
Paul.
well as,
Kung makapol, kala mo close. Hi, Paul.
syempre, of course, Dr. Bernadette Hogar. How are you? She used to be the president of, let me get this straight, Quality Care Association of the Philippines.
Well, I like me some quality care.
I know, right?
So if you're tuned in while working late or studying, this is Healthline. I'm Tina Ryan. Doc Ryland Flores is with us. How true is taking a micro break every 20 minutes is super, super helpful, Doc?
Well, let's put it this way. In muscles, there's such a thing as what we call too much activities. And if you persist in doing one activity for a lengthened time frame, you end up having strained muscles.
Then that leads to pain.
Well, whether they're big muscles or even with your eyes. I mean, you have muscles in your eyes. That's why they move up, down, sideways. Okay.
I feel stupid not knowing we have muscles in the eyes.
My ophthalmologist friends will.
Okay, go
will
ahead,
do
go ahead.
that.
So we do have muscles in the eyes. Okay.
So not only that, but they get strained.
Okay.
So if you kind of look at the computer and you work with the computer like most do, then every 20 minutes, every 30 minutes, try just to look afar or, close your eyes.
So when you say micro break, though, like a 2 to 3 minute break?
Just short ones.
Short ones, okay.
Just short ones. But for bigger muscles, I do suggest, if you're seated the whole time,
Ugh.
to at least stand
Painful.
up and like go around your seat for like 3
Workstation,
times.
maybe. Yeah.
For probably every hour if you can. If you can actually walk from like a short distance, like probably 15 meters or so, just so as you get your muscles moving, because they tend to be too much strained in one area that you have to stretch and move them out.
There you go. Coming from the expert. 6:40 on Healthline. Again, on our second hour, we have Doc Sushi. And yeah, thank you so much, Doc Ryland, for bringing her over.
We'll be bringing more and
I
more
love
and more.
having Doc Ryland here because that's one less stress for me because he's like coming up with all the special guests to bring here on Healthline and for everyone tuned in. Actually, again, we're live on playback.tv/magic899 right now. Speaking of, I wouldn't mind micro breaking to like maybe a dance routine every 20 minutes. Here's a song.
We love that.
Right? This one's called Who Knew Dancing Was the Sin on today's best music from Elliot James Ray. This is Magic 89.9.
Magic 89.9.
Hello, Metro Manila and beyond. You're tuned into Healthline, your weekly dose of good vibes, wellness tips, and a whole lot of heart. And right here on The Magic. And with me is Doc Ryland Flores, my official co-host.
Yes.
On our second episode.
I know, right? So that's Healthline for you. And when you're on the road, just take it easy. Whether you're in the office, you're in the clinics. For most of my friends are still in the clinics. Take it easy.
How late have you done your clinics?
Seriously, you're
Like
seriously asking me that.
1 a.m.?
Well, no,
Oh my gosh.
record is
The daughter's
2 a.m. actually.
the daughter's answering for him.
Yep.
Wow, that's
My record's 2 a.m. But, I don't intend to do that on a regular basis.
I just wondered if you've ever had like a super late night clinic because you just
Yeah.
couldn't say no to your patients.
We couldn't say no. For me, it's that if the patient's willing to wait because they really need to talk to you, the least I can do is listen to them.
Oh,
And that
your
reaches
dad's
to
such
2
a
in the
nice
morning.
guy. Mukha pa daw mabango. Hi to my brother and all the AU bankers. Tama ba? Wait, let me get it right.
Yes, it's AU backers.
Until what time po ang Healthline? Until 8.
8,
And we have a very special doctor. Well, special lady coming in, Dr. Suzanne Langkawan, Family and Lifestyle Medicine. And we are going to talk to her for the next hour. So please do not go anywhere. Hold
We'll
on.
try to find out what exactly is lifestyle medicine.
Here we go. AUB Salesforce.
Okay,
There you
sorry
go.
about Salesforce. We forgot about that.
Ayan. Hi to my brother and the AUB Salesforce. And thank you again for having us. They had me and Cholo for their Denim and Diamonds event a few weeks ago. So thank you. Sana po maulit. Okay. Hi to Cybery. And Jessie O'Mac was the one asking until what time po ang Healthline? Till 8 p.m. Again, to Christian and everyone on playback.tv/magic899.
So to everyone, that's every Wednesday, 6 to 8 in the evening.
Doc, what was the craziest case you've ever had to handle?
Oh, not craziest case. My longest case.
Oh,
My longest one was like a neurosurgery case. I was a general surgery resident. So it was a neurosurgery case that lasted for 25 hours.
I'm sorry. 25 hours?
25 hours. I mean, this was for the very first time.
You were operating for 25 hours?
25 hours. So this was the very first time that my attending, there were a brother team of both neurosurgeons, kind of nudged me and said, okay, you go out, you eat, you go to the bathroom and then eat and then scrub in, come back, do that, all of that thing in less than 10 minutes. I go, wait a minute, scrubbing takes 10 minutes already. But he was really serious with me leaving the area. But just because when I got back, it was his turn. And then afterwards, the other neurosurgeon. So it was like, we did that the whole entire time for like 3-4 times. Because the case lasted for 25 hours.
That complicated.
We
huh?
started 7 in the morning. We ended up 8 the next day.
Amazing. No, but isn't there like a golden rule as to when you should at least take a break? And dapat may
it's different.
reliever ba?
It's different when you're in surgery. I mean, the nursing staff, they're like on the specific hours, like 6 to 2, 2 to 10, 10 to 6. So if their shift is done, they get to leave. But as far as the surgeon is concerned, or even the assists of the surgeon is concerned, we don't. So if we have short cases for like 2-3 hours, that's good for us. But some cases end up like 6, 8, and for this one, I really will not forget it. 25.
What were you running on? Adrenaline.
I don't know. But we survived it.
Oh my goodness. Wow.
And the patient survived several months even afterwards.
Oh, good.
So it was good for her.
Good. 6:55 on the show. I do have room for one more song before I take a short break, and then another music sweep. And our beautiful guest is in the house. Here we go. Something from ITZY. This one's called "Girls Will Be Girls" on today's best music.
Magic 89.9.
Second time around for Lola Amor, Dance with My Mistakes. And I was just telling Doc Rylan, my awesome partner, I need a playlist for my mistakes.
Well, I was just asking
Too many.
how much memory would you need for that playlist?
10 terabytes. I need the whole iCloud, the damn iCloud. This is the second hour for Healthline, your go-to show for your medical needs. Medical needs! Oh my gosh, I can't believe this. I found an awesome co-host. It just gets better from here. Diba? High five, Doc!
High five!
We're live on playback.tv/Magic899. And finally, okay, I think she's warmed up. I think she is.
Definitely.
It's time to get real with tonight's guest. She's a healer, a helper, the kind of doctor who sees the big picture. Please welcome family and lifestyle medicine specialist, Dr. Suzanne Langkawan, or as her patients lovingly call her, Dr. Sushi. I just had sushi for lunch. It was wonderful. But oh my God.
It was fresh, like
Yeah, super fresh, just like you. And yeah, Doc Ryland's daughter, Bella, it couldn't be any more correct. You look like a college student.
oh, thank you so much. Thank you so much for the compliment.
Oh my goodness.
I think I'm loving it here.
Minsan, alam mo, Doc, hindi ka ba, what is the word? Minsan kasi, hindi intimidation eh. Di parang, there are times yung mga Pinoy na medyo older, pag nakakita ng mas batang doktor, they seem to parang,
No, you're not gonna
naku,
treat
do you get
me.
that?
Yes, I get it a lot nowadays actually. Like for example, this one clinic of mine. So I actually called in a patient. Then the usual consultation has been done. Then they would interrupt me in the middle of the consultation and ask, excuse me po, kayo po ba yung doctor? Like, yes po sir, ako po yung doctor. So because they always ask my age, you really look young, doc.
You do, Doc. I mean,
Thank you so much.
yeah.
Told you.
Yeah. Well, I mean, in 20 years, she's still gonna look like a college student. Diba? No, ano na, resident.
Resident na.
Diba?
But speaking of residency, not just resident, but you know our names, like for instance, my name, Rylan Flores. I have the MD because I'm a doctor. But after that, you have a whole lot of acronyms in the end. So I have like a few. This lady.
She has
beside
more
me,
than you?
She has like a couple of pages of that.
Hi. Please tell us
Behind
about.
her name.
Can you please brag? What else?
No, just because like we were talking about how young she looks and all, but just so as our listeners can tend to try to understand everything that she's been through, like she has several already of trainings and all of these titles and everything else, and she's about to do her PhD on top of everything else.
Hindi ka naman busy, Doc.
No, but I'd like to believe that I really manage my time well.
Okay, that is my downfall, time management. But let's start from the top, Doc. Lifestyle medicine sounds very holistic, at least to me. Okay, that's just to me. How is it different from the usual consults most people are used to?
So basically, here in the Philippines, the consultation would actually just go about asking, ano po yung gamot? So that's the common we really hear from our patients. Sakit sa ganito, ano po bang pwedeng gamot na ganito? But if you'd really listen to your doctors, we would actually go about trying to modify or trying to use non-therapeutic interventions first. Like for myself.
Non-therapeutic.
Yes.
What does non-therapeutic
Yeah, I'm like,
actually mean?
I'm like dumbfounded. What's
No,
non-therapeutic?
the therapeutic part would be the medications that we prescribe our patients.
These are like the
But-
over-the-counters,
Yes,
ganon. Okay.
prescription drugs, over-the-counter medicines that we actually advise our patients to take. However, there's a non-therapeutic part, meaning to say we dwell upon the lifestyle modifications that we
Oh,
actually
you break
ask
it
our
down.
Yes.
Oh, okay.
So basically, some would actually omit that advice from us doctors because of course they just wanted to address how they're feeling, because basically that's how Filipinos go about.
Because we're used to, we go to the doctor, we
Yes.
get the prescription.
They give you meds and that's just
that's
about it.
Oh, that's it.
They actually do the consultations because they're feeling something already.
Yes.
So basically, they really do or seek medical advice when they're feeling pain or they're feeling something's off within them. So that's the time that they seek consultations.
Kasi di ba, Doc Ryden, ang pain is a medyo bad indicator na. Like something is really wrong na.
It's the main reason why patients would come into the doctor's clinic, because otherwise, if you don't have pain,
Yeah,
why the heck will you be there?
Yes.
So the fact that there's pain, the fact that they are there visiting the doctor means that they do have pain somewhere.
Okay. Doc Sushi. I love the name. Doc Sushi is with us. For those of you just tuned in, lifestyle. No. We've got family and lifestyle medicine doctor, Dr. Sushi. Okay. What are the biggest health myths you keep having to correct with your patients?
So basically, there are a lot of common misconceptions of our patients.
Oh, give me one.
Like for example, they try to ask for several medications when in fact, like just a basic example would be the supplements. They would ask for several supplements when in fact you could actually get it from your diet, the natural diet.
Eating proper food.
Yes,
diba?
eating proper food, the proper choice of your food. So there's really no need for one to take supplement unless that it is already decreased within our system.
Yeah.
So basically, we could actually find it in our usual diet.
Like the food pyramid?
Yes.
Ba yun?
Well, okay, there's no more
Kasi di ba yung food pyramid, medyo
I
luma
was
na
gonna say,
yun.
there's, luma na yun. That's why we have the Pinggang Pinoy, or because it's circle.
I've never heard that. Wait, Pinggang Pinoy?
Yes.
Yeah, it's a circle now. It's no longer a triangle.
When did the DOH release that? I wasn't told. Pinggang Pinoy.
Yeah.
Okay, interesting. Okay, I will research that. Okay. So again, so another common biggest health myth besides, the one that you just mentioned, is there another one that you want to share?
Basically, about I think the weight nowadays. So it's a very sensitive topic, I guess. But however, we really have to delve upon it. Like for example, obesity or being an overweight, it would actually predispose one to several non-communicable diseases.
Oh, di ba nga, may order si
we were
General
just-
Torre.
Yeah,
Diba?
we were just talking about it. There was a study made in that for a person to actually try to seek consult because they're either overweight or obese might take probably a couple of years. The problem is on the side of the doctor, for us to actually do something about it takes around 4 years. So imagine for an overweight or obese individual to actually do something about it, it takes around 6 years. And unfortunately, by then, there are a whole lot of complications that might arise.
It's a bit late.
So that's why we encourage the patients to seek consult and just talk to your doctor, in as much as for doctors to actually probably be a little proactive, because as Doc Sushi mentioned, it's a very sensitive topic. So doctors, like, I don't want to talk about
My
Can we talk about
weight.
weight, because you might just get slapped in the face because ay mataba ba ako?
Yes, they get offended easily.
Oh my gosh. I think if the doctor tells you you're a bit overweight, you should not get offended. I think that's the more reason for you to listen
Yes.
Diba? Because,
But
go.
yeah, but with the bestie, I mean, it's two pronged. It's not just simple exercises or your diet, but there are a whole lot of things that are involved in the bestie, not just these two.
And that's where Doc
That's where
Sushi
she
comes
comes
in.
in.
Yes,
Okay.
lifestyle medicine would really help a lot. So
So,
basically,
yeah.
you'd ask what's lifestyle medicine? How is it different from other specialties? So basically, lifestyle medicine uses evidence-based researches in order to back up our 6 pillars, and that would be nutrition, exercise, your sleep, stress, socials, social connections at that, and the other one would be substance abuse.
Oh.
Social connections, is that partying?
Is that dancing on TikTok? TikTok! Okay, well, wait, I'm sorry. You said the last one was
Substance abuse,
Substance abuse.
like your smoking,
Alcohol.
alcoholic beverage.
And drugs.
Yes, and that.
wow. Okay.
So that would be the 6 pillars of lifestyle medicine. So basically, we use evidences to back up it. So we are to be able to be updated on what are the lifestyle modifications we are to advise our patients during consult.
How big of a factor does alcohol play?
Oh, there is a lot, of course. So basically,
Because I'm asking this from the heart because. Whoa! Is that our phone?
Is that a phone?
Oh my gosh!
Wait. That's the first time we rang.
Wait, okay. Hi.
Hi,
Hi. What's your name?
my name's John.
John.
Such a good topic that you have tonight.
John. I'm just I'm overwhelmed because I'm finally getting the phone line to work.
We've been
I'm
trying
so
to
happy.
work.
John, I
for a
want to
long
give you a
time.
prize. I don't know what I want to give you, but I want to give you something.
I don't have to, that's fine.
John, are you asking about alcohol or just the whole
No,
topic in
no.
general?
I was quite intrigued with what the doctor said. You have to talk to our doctors, right?
Yes. So
The thing is, most of the time, doctors don't listen. How do we go about that?
Doctors don't listen.
I'm sorry. Did he just
No.
say doctors don't
Yes,
listen?
Yeah, they don't actively listen that much, so we couldn't really open up what we want to say. So
John, could you turn down your volume a little, just a little, okay? Para hindi ka ma-echo.
right.
Okay, now I have 2 doctors here. How do you want to answer back to John?
Ladies first.
Ladies
I
first.
will have Doc Sushi,
John, please stick around.
Comment on that first.
okay, I am so sorry to hear that, John. So that I don't know what to say about it, but I guess I would be able to speak as a family medicine specialist myself. So basically, one of our thrust is active listening skills. That's what we are trained for during residency training.
Okay.
So we are to be able to establish rapport to our patients. So there's
Trust already.
yes. So we were trained to really actively listen to our patients. So of course, the patients would be able to subjectively tell how they feel, or that's where we get the common misconceptions, and that's how are we to be able to address it properly. So I'm really sorry to hear that based on your experience.
Maybe you
John.
just went to the wrong doctor, John. I know 2 good ones now in front of me.
Yeah,
Come
John.
over. Okay.
Well, on my experience, because for one thing, if there is one thing, I will agree with Doc Sushi that we literally listen to our patients, and we don't care if you're a private patient, an HMO patient, or even a charity patient. We will
Aw.
treat you regardless of if you're paying or not, and try to listen as much as possible, because we try to find out from listening what the actual problems would be. So, unfortunately, I would just have to say there might be some, because of the really big bulk of the number of patients,
Yeah.
that they end up just doing how'd you call it, a dicahon thing.
Yeah.
So unfortunately, that might be happening.
And it's kinda happened
and it
to
might have
John.
happened to John. But
Yeah.
we're sorry about that. But most of us actually do listen to patients.
Yeah.
That's the reason why we're just talking about it, and we end up more than past midnight, just so as we try to accommodate all our
But
patients.
I hope John was able to get or receive the proper treatment that is
But-
actually.
Let's ask him. John, were you able to find a good one that listened to you?
Well, he the doctor dismissed me, so probably not. But don't get me wrong, I still have huge respect for all the doctors out there. I understand how stressful the work is.
Do you-
Yeah, probably the doctor was right. I was just in the wrong doctor.
Aw,
But I
but
do hope,
Fine,
I
that's
I
fine.
do hope,
still have
John.
a huge respect to all doctors
Aw.
out there.
Thank you, John.
Absolutely,
Thank you so much,
absolutely
John.
fantastic work that you guys do there.
But I do hope whatever your problem was.
do you want to talk about it now?
properly
Because
We'll probably talk about it off air, and we'll try to see how we can help you.
yeah, and maybe I don't know what is your main concern, so we can refer you to the right one, the right doctors that will listen to you.
I'm in the middle of body recomposition because I do lift weights.
Oh.
So the doctor just kept on telling me that I'm obese. I said,
Okay.
hey, doc, I am weightlifting. Yeah, but
Oh, okay. I actually will. Okay, I'll break down because that's most of my patients. I deal with athletes, so what we actually would do is, if you do have a problem, I break it down in three. First and foremost is you do need to address the pain. That's the reason why you might be seeking consult, or any problem, uncomfortability, irritability, or whatever you might be feeling. We need to deal with that, and basically that would include your rest, your other modalities, not just medication. And then the second one is we do go back to setting and strengthening your muscles, because we need you to go back moving. But if you mentioned about being overweight or obese, that's the third one. If there's one thing I don't tell my patients, is to lose weight immediately. Why? Because if I tell my patient to lose weight, you know what's going to happen? They won't eat. And if you don't eat, your metabolism will go haywire. So that's actually
So
the
screw the
third
system,
thing
yeah.
that we would do later on, from resting it out and doing what needs to be done to setting, strengthening all of these muscular areas. And then we look at your metabolism and we talk about how to deal with overweight in the best. I'm sure Doc Sushi will agree with me for that. So you can't do all of these things at one point in time. It has to be staged.
Ayan. John?
yep,
I
that's the free
can-
consult right there.
Usap tayo lang dyan. Okay, usap tayo.
I'll send you Doc Ryland's number. How about that? Yeah.
Thank you,
Actually,
thank
the
you
one
guys
I've
again.
been telling about earlier, isn't it? It's a very sensitive topic. However, we really have to have that self-awareness regarding that one, since obesity now is one of the silent killers, actually.
That's so true. That's why the studies were made for it, because people were wondering, even doctors were wondering, like, it is increasing. It's becoming in epidemic portions because of the food probably taken in, or the activities, or the lack of
Lifestyle.
activities, basically lifestyle. But like what I was mentioning a while ago, it's not just activities and food. There are a whole lot of things that need to be considered: hormones, your family history, your genetics, and everything else come into play. And we need to look into each and every one of these aspects. Just
Ayan,
to
John, I hope
Yeah,
that the two
of course,
doctors
if you
made
don't
up for the one doctor who didn't listen to you.
But actually, that
because
would be the
I did
partnership.
tell my doctor
Sorry.
that I was at 4% body weight. Body fat, sorry.
4% body
Yeah, I was
fat.
at 4% body fat. I'm at 4% body fat.
Is that good? That's a good thing.
But the doctor kept on telling me that I'm obese.
No, actually, ma'am, I think, well, basically, that would be the one I mentioned earlier, to be able to establish rapport, since that's a partnership thing with the physician and the patient. Because if the physician would just dwell upon the body mass index, so basically that's just a computation of one's weight over
That's just
height.
one aspect, right?
Yes.
Dr.
So
Sushi?
basically, I go about telling my patients, please don't be devastated with this one, because basically, the fat percentage here is not. It's basically a computation of everything: your muscle mass, your fat. So basically, I tell my patients, this is just a computation of your weight over your height, but the proper way to be able to know if it really is a fat percentage within your body, that would be the caliper.
Ayan.
So that would be a partnership thing between the physician and the patient.
I agree with you. Thank you very much.
Thank you, John,
My
for...
pleasure.
Shout out to all the
John.
doctors in Medical City.
Name drop.
Thank you guys. Bye.
Oops. Okay. Thank you, John. Bye.
Our
goodness.
phones work.
What? Oh, I forgot to turn off the ringer. No, I couldn't.
But now we know it works.
Yeah, it works because I just I can't make it work, Doc. Finally, you're our
So it
lucky
works.
charm. You're our
See?
lucky
I
charm.
told you.
Doc Sushi is with us. She's a family and lifestyle medicine doctor. And speaking of sushi, hi to Stan, who's picking up sushi around the circle in Mandaluyong. Uy, wag naman. Hindi ka pa naman obese. Why don't you consult with Doc Sushi regarding your problem? Diba? You can't just say I'm obese because I work from home. But if you need help, they're here. Stan, okay? 8631089. My next question. Okay, give me 1 second, Doc. Anybody you want to say hi to?
Actually wanted to shout out Quezon City Medical Society. We're actually preparing for our 40th annual convention.
And it's tomorrow, yeah. Oh my goodness. Oh my god. Congratulations.
So I kind of pulled her out of preparing for all of these things.
Look at you.
So they're looking for her right now.
Sakalam si Doc, no? Let's talk about relationships. How does lifestyle medicine help families and not just individuals?
So basically, that was what I've mentioned earlier, the social connection. So one of which would be to be able to positively have this relationship with everyone around you rather. So that would be the part of me talking as a family medicine specialist, because we use what we call the PFC matrix, that would be patient-centered, to which we cater on the consultations with our patients, but we also include the family part and even the community part, because we wanted a holistic collaborative efforts towards the holistic
So this is a
wellness.
little different. So lifestyle medicine and family medicine.
It's
this is
actually
where-
marry the two
Oh, okay.
specialties when I consult my patients, Doc Rylan.
See, she has two specialties already.
But Doc Sushi, so that's a social part, diba?
Yes.
Yung addiction to certain substance like alcohol. Yun yung question ko earlier. How big of a role does that play?
Well, alcohol, not really about alcohol, but that would be smoking, alcohol, and even the addictive ones. Well, basically, they really disrupt the normal pathways or pathologies in our body. So basically, what we wanted is to actually prevent it from happening. So we really don't really stop our patients from doing so. We actually have healthy drinking habits. Like for example, like a glass of wine would do for a certain time, but not every day. So basically, we try to modify it. But what we wanted is for it to be sustainable in the process. Because if we advise our patients to really stop it at the moment, so that would be a problem, because there would be
The
a
tendency is-
rebound
the
to go
tendency
back to what
is to
they've
go back.
used to.
Exactly.
Or even more, perhaps. Because there would be the, how do you call that, Doc? Yung parang uhaw.
Hayok.
Yes,
Is the
that's the
term.
better term. Hayok is a
No,
better term.
it's
I like
actually when you are deprived of something, the tendency is you crave more for it.
So
that's actually the term for that.
Okay. So
Because try to notice in European countries where vineyards are left and right, like wines are a big thing. Even your hard drinks are a big
Yes.
thing. Even your beer is a big thing, and they even partner it with particular food.
oh yeah, like
dessert.
pairing.
Yes.
Yeah.
Exactly. So, but the thing is, you kind of control it. The problem lies on when everything now is in excess. So instead of Doc Sushi was saying a glass of wine, you end up with a
Naging
whole
three
box.
glasses of three
A box of
bottles.
wine.
Three
Hindi
bottles
nga,
of wine.
box na yun, ubos na yun.
There's this Filipino term, di ba, Doc? Yung gano'ng kadalas yung minsan.
Ay, favorite Basil Valdez song ko yan. Gaano kadalas?
So basically, I get that a lot. Minsan lang naman po, Doc. But I ask, how
Minsan,
often is
di ba?
minsan?
No, I think based on experience, parang naapektuhan yung social part ng relationship if you're dealing with somebody who abuses alcohol. And I think what I was trying to ask is, I thought I was going crazy, because I was led to believe that I'm the one who had a problem because I couldn't accept the drinking part. But I was already parang getting to a point where manipulation because diba?
It became everything about
Well,
you.
try to look at smoking. Back probably in the 70s, 60s and the 70s, it was really an in thing. I mean, you had to smoke.
It's still an
That's
in
why
thing with my mom.
with that generation.
Yeah.
But if you notice, the more people became aware of the complications that arise, not just say lung cancer, but a whole lot of other disease entities, not just from the lungs, but different organs as well. And they now end up decreasing until they stop. So, although there are still a lot of people smoking out there, but it's still not as high as back in the 70s when it was the norm to smoke. Nowadays, it's not anymore normal for you to see. Plus the laws right now that you have to be in a smoking section. You just can't light up a cigarette anywhere. So all of these things kind of decrease the amount, but there's still a whole lot of them.
Oh, yeah. A whole lot of them. It is 7:32. I have to take a quick break. This is such a good topic. John, again, thank you so much for calling. I'm so happy. Finally, the phone worked. You're such a lucky charm. Doc Sushi in the house with us. My partner, Doc Ryland. I'm Tina Ryan, for those of you who just tuned in. Healthline is going to take a quick break, and then more of the doctors when we return.
Magic 89.9.
Okay, today's best music, Magic 89.9. And that was a really quick song. Welcome back to Healthline 737. Doc Ryland Flores, my co-host, with me, who brought a very, very beautiful family and lifestyle medicine doctor, Dr. Sushi Langkawan. Okay, we were talking off air. We all got caught off guard.
Lovely conversations.
Oo nga eh. But it hits hard, huh?
True,
It's
so
hard.
true.
So if you have any questions, our phone's really working because we heard it ring.
Or you can message
I
us on
turned it
Viber.
off. 863-10899 or the Viber number
At
is.
0945-971-4011.
You have more shout outs, Doc, though.
Oh yeah, right now I'm saying hi to Joey Resho. I think it's
Why
in
does it sound
traffic.
so familiar?
Because he's one of the members of the board of the Alumni Association
met him. Hi,
of
Joey.
LaSalle Green Hills.
Sup, Joey?
And there's actually a meeting ongoing right now for the homecoming for next year. With all the
Nice.
co-host batches.
I am dreaming of hosting.
You want to host?
Oh my gosh,
We'll take care of
LaSalle's
that.
never gotten me to host.
We'll take care of
Why?
that.
Am I not? Yeah, maybe I'm not sexy enough for the LaSallistas.
I'll keep my mouth shut.
Doc, lightning round. Yes or no? Or it depends. Are you ready?
OMG. Okay. Let's
Both of
try.
you guys. Juice cleanses.
Sorry.
Juice cleanses. Look, there's hesitation. Okay. Doc, ikaw.
Well, it depends actually.
Depends, okay.
I'm more of the yes and no or
Okay.
yes or no.
Drinking
But,
coffee after 3 p.m.
Again, it depends for me. No, because there's such a thing as
Yes or no?
Para
Okay,
mas safe ko
sige,
palagi.
that's a battery.
But there is actually a gene specifically for coffee metabolism. So if you're beneficial, you literally can drink coffee regardless of whatever time it would be. But for those who have non-beneficial genes for coffee metabolism, nothing after 3 o'clock. Because otherwise, unless you're watching K-dramas, you'll be up.
Will be hooked.
You'll
Or
be hooked.
working for graveyard.
Or working for graveyard.
graveyard
Coming from somebody coming
shifts.
a shift in the
Graveyard
hospital.
shifts. Skipping meals to detox.
No.
No.
Oh,
Definitely no.
And a lot of people do that.
Oh, we can
Why
talk
so?
about that. I
Why
will
so? Doc
I will give the
Sushi.
lady.
Why do you
Well,
think?
basically, you're starving yourself. So I think, well, they think they're using up the deposits in our body in order for one to slim down. However, you're really depriving yourself of the good nutrients that you actually get from the food we eat.
You literally, I think it's not just going hungry, but you literally starve yourself. That's the reason why the concept was it uses up fat so that
To be
for you
energized.
to use, yes, it's energy. So the tendency now is for you not to eat, but the problem is, again, when you go back to eating, you end up probably eating more than you should be. So for me personally, I would rather go for the timing of it all from the time. That's why you have your morning meal, your lunch, your dinner, and then your fasting, which is basically from the time you sleep until
You
the time you
sleep,
wake up.
yeah, okay.
And that's the reason why it's called breakfast. So
You
all
break
of this,
your fast.
you break fast. All
Yeah.
these time differences, you actually have to eat well, eat proper food, because there's also such a thing as your glycemic bell curve of when your sugar levels are actually on high, and when it goes down, that's the time you have to replenish. And like your car, you have to put gas in.
Yeah, okay.
Or rather than starving yourself, why not count your calorie intake?
Much better
Oh,
than
so
that.
do you count calories?
Well, basically mine, I don't. I'm really sorry about
Well,
that.
'cause
I was
there's
gonna
nothing to count. You're so tiny,
I
though.
was gonna say I'm poor in math, so I don't count.
She's so petite also, Doc. But like, I know I pretty much suck at calorie counting because I know I eat more calories than I should. But for
For me, instead of not just that, but as a start, of course, calorie counting is one of the best things that you can do. But as a start, I love the term in moderation.
everything in moderation.
So, I mean, because you do have your macronutrients, that's your protein, your carbohydrates, and a little fat. So you do need that, but everything in moderation. Otherwise, if you eat a lot of everything, so I'm not saying don't go to buffets or eat all you can restaurants. I mean, you can go once in a while. I mean, we all do that, but not on a daily basis. Just because it's so reasonably cheap that you actually end up eating every single day. I mean, for lunch and for dinner, just because you don't wanna cook, you don't wanna do the dishes, and it's more practical from eating. So, because I do have a patient, I had a patient. Her family were all my patients, but this particular lady, she was a patient of mine for some other things, but she came to me because she wasn't feeling good. She wasn't feeling well. So for whatever it's worth, I did a blood workup. I compared her blood workup from probably 4 months prior,
okay.
and her triglycerides, her cholesterol, even uric acid, all all very high. And I go, I mean, from a very normal to not just slightly above normal, but really high.
Alarmingly
I go,
high.
like what's happening? What are you eating lately? She was like kind of quiet, but they're a newly married couple. So the husband goes, it's just like, sabihin mo na. Sabihin ng ano sabihin mo. And just so as, Doc, kasi just at the corner of our street, there's a new samgyeopsal place, 250 eat all you can. So I mean, for a couple, that's $500. They don't need to cook anymore. They don't need to do the dishes. I mean, and they enjoy
the
all of it.
convenience
So it was
of it.
okay, but for the next 2.5 weeks, they were literally there every single day, and sometimes
Uy,
twice
mahal
a
na
day.
rin yun, ah.
No, I hate to
but
interrupt,
yeah.
Doc Rylan, no? Because I get that a lot. Parang I'll hear patients telling me, Doc, ang mahal naman kasi ng healthy.
Yes, isa
Totoo.
pa yan.
Yes, but if you
Totoo
come to think of
naman.
it, if you'd really look a long way ahead, it is actually like you're investing to actually preventing you from getting that disease that would actually
Yeah.
predispose you to a multitude of like spending with medications
Mas
or,
mahal kasi in the
or
long
even
run.
addiction.
Yeah.
So I try to talk my patients into it.
Plus the fact
Look
that
at it as an investment.
plus the fact that your lifespan decreases because of all of these comorbidities that you
Yes.
end up.
Goodness.
You might just end up with if you don't have them at this point in time.
I do have Doc Sushi. I have a question for Doc Rylan here, if you don't mind.
Sure.
I have pain kasi in my deltoid muscle part. Baka from exercise. How can I relieve the pain? Syempre, she's trying to bring back Katawang Barbie daw, made in 1975. So she doesn't know if it's from weightlifting or push-ups.
Well, right now, because there's pain, I would actually recommend to aggressively rest the area because the tendency is not.
Is this the time to ice it? Or warm compress?
No, it depends on the
confusing
time. It depends on the
Okay,
time.
okay.
Of course, after your workout, you can actually ice it. But if you're not working out, it's a warm compress because we want the relaxation of the area. but we need to rest it first. Like what I said a while ago, we need to rest it, aggressively rest it, because more often than not, the mindset is, Doc, if I don't exercise, I'll grow big. But, you won't grow big in a day or two, or even 5 days, which I would usually recommend some of my patients to. Like, just simply no exercises for the next few days. And then let's look at your form after that.
Okay.
Because when we get you back to exercises, how's your form? That's the reason why some of the exercises I would rather, even with lesser weights and lesser reps, but you have the proper form,
posture.
proper posture, your results might be better than just haphazardly doing all of these exercises,
Yeah.
or pulling up the weight as high as you can, just so as you'd find out that, oh, I can do it pala. But in reality, I would rather go for the form. And then we increase from that. That's why there's such a thing as what we call setting the area. So let's try to probably visit and look into it and see how everything else is dealt with.
Pong, I hope you heard that loud and clear. Rest daw muna. Bringing sexy back won't hurt if you rest for a few days, diba? Doc Sushi, back to you.
It's like a tennis game over here.
What was my next question? Ayan, wala na naman. Because I'm multitasking here, and Doc
know.
Ryland's, I have proof. Let's talk about stress, because it's become like a badge of honor lately. But everyone's busy, exhausted, anxious. Well, how can we realistically deal with stress?
Well, basically, that would be about how you manage your time well, I guess. Because basically, all are like working here and there. But we really have to have that sense of balancing everything, like work-life balance. We really look for the things that we enjoy doing. Just take a pause. Again, rest in between. It would really go a long way in actually managing stress, because basically stress is everywhere.
I know. As a matter of fact, for me, it's not really stress that's a problem. I mean, people are saying, I have all this stress. I hate stress. Stress is bad. Literally, stress is not the problem.
There's
It's
good
actually
and bad
how you
stress.
deal.
Yeah. Well, meron bang good stress?
It's actually how you
like that.
deal with stress, how you perceive
Yun.
that stress. So if it actually is uncontrollable already, then that's where it piles up and you get all of these complications. There was one, I gave this talk long ago, and stress was part of it. And I was telling everybody, like, I'm sure if I ask each and every one of you, you'll be
Lahat
giving
meron.
me different stresses from anywhere, from finances to my partner to
Love
my
life.
boss to the traffic to wherever,
Oh.
whatever you can think of. But we still get to smile. We still get to interact with
Yeah.
our colleagues, friends, family. But there was this lady who was like really like ano yung term, pasan ko ang daigdig.
Wow,
really,
Sharon Cuneta.
really looking bad, and I go, but I just want to point out, like, what's your problem and why are you feeling that? Everybody's smiling and laughing, and you are actually feeling so down. You know what she told me? Doc, kasi it's a Saturday. I don't know where to bring my boyfriend.
Oh my. Wow.
So
That's kind of problem I want to have.
So it depends on what that stress is and how you actually perceive it. Because
I'm sorry, ayoko na pala mag-boyfriend.
for a whole lot of us, it might just be a menial problem, but to her, it was literally
Yeah.
a heck of a load of a problem. So it really is how you perceive that stress to be.
Not that we're judging anyway. Not that we're
No, we're
judging.
judging. No,
How you
no
take
judgment.
it in, how you respond to it.
Yeah.
Exactly.
Okay. So ikaw, Doc, I mean, you're the guru now, diba? Being the family and lifestyle, diba? I mean, how do you deal with stress personally?
I want to bring that to the
Diba?
society. The guru.
Eh, diba? Parang may nasa-stress ka pa ba lately?
Yes, of course.
Okay,
Actually,
but
going
See, tingnan mo ang
here,
stress.
I rode the angkas and it started to rain.
Oh, yeah, nakaka-stress.
Yeah.
But how do you deal with like a yeah, how do you deal with stress on a regular basis?
Well, basically, look at the positive side of things, I guess. So it is actually our choice on how are we to respond to our stressors.
Oh.
So if you wanted to really be burdened about it, so that would really drag you down. But if you actually look at the good side of things, then actually it would actually help you lift it up.
Oo nga naman. So it's the way you deal with it.
Yes, because I would always tell people, patients, or even when I do give some talks, is that I would prefer that we have stress. Think about it. I would prefer that we have
Because life would be
stress.
boring?
No, not life would be boring, but simply it will tell us that we're very much alive. Why? Because if you don't have stress, others would be stressing because of you.
Oh, I know the good kind of stress.
Yes.
Like where to spend my hard-earned money. Oh, ganun yung mga gusto kong stress. Doc Sushi, didn't the hour went by just like that? Diba? Ang bilis. It's 7:51
Oh, really?
already. Where can people reach you if they want to do a consult?
Well, I actually am a hospitalist at Amang Rodriguez Memorial Medical Center. That's for one. But I do have several clinics at the Medical City Clinic as well as Shinagawa Diagnostic and Prevention Clinic. And
Shinagawa for the eyes?
yes, we actually already cater on diagnostics.
Wow.
And, of course, family medicine consults. That's for
Wow,
one.
awesome.
Yes.
Among all of the things that she's doing.
And actually, you can reach me at TikTok.
Ayun!
Told
TikTok
you.
si Doc.
She has
Are we
this-
gonna do like a dance? Because I just did my second TikTok dance.
That's how I relieve my stress.
Okay, I found a new friend because I love to dance, Doc. I love to dance. Doc, anything else you want to leave our listeners with? What's one thing you want our listeners to?
Basically, not everything is about taking in medications. You could actually start with your lifestyle by choosing the good food to eat, the healthy activities to actually start you on with, and to actually just do the proper choice in how to deal with stresses and to do positive interactions with everything around you. It's easier said than done, but just start to be kind. Because again,
I like that.
yes, as what Dr. Rylan mentioned, we really don't know what the other person is going through. So there's nothing that could hold us back than just being kind.
Oh, let's be kind.
Let's
I
be
always
kind.
I used to leave Friday Madness with by saying if you have nothing good to say, shut your mouth.
That works too.
And that is a wrap for Healthline. Doc Rylan, anything else you want to add before we say goodbye?
Well, we just want to reiterate the invitation to all our colleagues, whether you're from Quezon City or not. We do have our convention tomorrow.
Nice.
So we
What's
are
it
inviting
for? You guys have like I don't know, like do you have a musical guest? Or it's just a lot of learning tomorrow?
a lot of
We
learning.
are the artists.
Nice, nice. I like that.
But
I
we wanted
like
to
that.
invite everyone. It's our 40th annual convention and scientific
Yes.
meetings, and it's actually a preparation with our
75th
foundation
anniversary.
anniversary.
Next month.
So happy anniversary to Quezon City Medical Society next
Yes,
month.
happy anniversary.
Big love to you, Dr. Sushi Langkawan. Again, you know where to find her on TikTok. And my awesome co-host, Doc Rylan Flores. And all of you listening, remember your health is your power. Catch us back next week. Who do we have next week?
We're gonna
talk about skincare.
Skincare, what to put, what not to put, why to put, why not to put.
I've neglected this for so long.
I'll be listening to that.
And we do hope we all see you every Wednesday at 6 to
Yes,
8.
that's right.
Healthline with Tina Ryan and Doc Rylan here at Magic 89.9.
Thank you so much. We're leaving you all with Silent Sanctuary. This one's called Sagad. Ayun, nasagat na ako, Doc. Hang on time for the boys.
Magic 89.9.